Hi everyone, and welcome to the Africa Summits, part of the Holland IQ Global Summit Series for 2022. I'm Lucy Blakemore. I am the VP for Global Insights at Holland IQ, and joining me today is Emma Caddy, who is the CEO of Tiny Totos. Hi, Emma.
Hi, Lucy. Pleasure to be with you today.
Thank you so much. And I know we've got so much to talk about to find out more about Tiny Totos. Normally we go straight into some slides, but Emma's actually going to start by sharing a 90-second video to give us a much better sense for what this service is all about and how it looks and feels and comes to life. So Emma, if you'd like to share that video.
Yeah, thank you, Lucy. I hope this will immerse the viewers into the realities of childcare in a dense urban city such as Nairobi. So give me 1 minute and we'll start off.
Wonderful, thank you. And I'm just going to bring up your slides so you can take us through a bit more of the detail behind how all that happened, what it's all about. And yeah, please go ahead.
Thank you, Lucy. So Tiny Totos is a Kenyan-based social enterprise that works in the informal childcare sector. The challenges that we face are common throughout the region. We began in Nairobi. I hope the video that you saw could show the challenges that mothers face in these low resource settings that are found in Nairobi, but typical throughout the African continent, where we have very urbanized cities that have poor services. Mothers have to go to work. They do not have a family network that has been left behind in the countryside to lean on. And therefore, in order to get to work, they must find a way to have their children well looked after. And with no state support, that usually is found in the neighborhood in which they live. So our mission is ultimately to transform childcare, which is largely left in the hands of the informal market, and ensure that millions of children and women can get access to quality care. So as the video alluded to, and as I've mentioned, Africa's facing a looming childcare crisis. The continent is projected to have 1 billion children by 2055. But with only 1 in 5 of those receiving decent early learning and care before 5, during a period of their growth and their development when 90% of their brain is formed, that has serious repercussions for their potential to reach their full kind of life's abilities, their potential as adults down the road. And that's obviously a challenge for the individual, for the family, and for the country and continent overall. As long as 80% of children are not really getting the nutrition, the stimulation, the socio-emotional care that they need to become fully functioning adults, that's going to have massive repercussions on their performance as productive adults, as employees, and all the rest. And while there's a huge amount of interest, as there should be, in improving primary, secondary, and tertiary education, the reality is if a child is on the back foot for life because of poor care, received before 5 because they were stunted by 2, etc., they will never fully capitalize on the educational resources that happen afterwards. So that institutional blind spot that they suffer from birth to 6 years old ultimately will hold them back for life. So what we do as Tiny Totos is accept the reality of the status of childcare in Kenya, as many other countries in the region and actually really in the globe, where it's very, very, very rare to find a state able to provide subsidized care. I think Scandinavian countries are perhaps some of the exceptions, but around the world, this is not typical that governments are able to provide support to women. And of course, what happens is women all over the world see their earning potential drop when they have children compared to men, but also compared to women who don't have children. And now, if you have the means, if you have the education, you can afford a decent level of childcare to be able to still focus on your work. But if you're a low-income mother, that's simply not possible for you. And these informal babysitters who crop up and fill the vacuum of care and the need and address the demand are, perhaps very well-meaning, but they do not have any foundation of knowledge around the principles of early learning and how to stimulate children. They don't have any business skills. They may have left school themselves as 12-year-olds or 14-year-olds. And so the challenge for them, without business or childcare skills and without any support out there in the marketplace, is how to run a decent daycare center that gives them a decent livelihood in return, that enables them to be able to sustain this operation and also give good care to parents, and of course ultimately have children grow up in decent environments. So we have seen many times charitable interventions trying to subsidize care, but it's not scalable. For us, knowing that in Nairobi alone, there are probably 2,000 to 3,000 of these micro businesses operating every day, looking after 150 to 200,000 children. We see the opportunity to address the childcare market as a market, to do what has been done in formalizing informal markets in transportation, in goods, and in other services, to give a combination of business skills and sector-specific skills, in this case childcare, to layer on technology and professionalization of service, so that all these individual daycare managers operating in a fragmented market can get the same access to knowledge, capital, and network that any SME needs in order to grow. So here we summarize ultimately the buckets of support that we give them in-person and digital training to make it cost effective. We start out with an immersion in the skill set for running a good childcare, but then we support it over the phone and with video clips, WhatsApp, and all the rest, and periodic meetings as well. We give them access to capital so that they can invest in improving the facility and investing in a kitchen. So probably the biggest way of diversifying income is getting them to sell food, which is of course critical for children's development, to get nutritious food. But it also provides a really decent extra layer of income for babysitters who previously were just providing babysitter service. And yet once they get the skill set to cook nutritious meals, 25% of their revenue is coming usually from food of a quality that an individual mother cannot afford. So we have a double, triple benefit of children get better nutrition, daycare gets more revenue, and the mother has that burden off her head of wondering what the child is going to eat, how she's going to get food sent to the daycare. We do a lot of peer learning and social networks, so we recognize that the entrepreneurs themselves teach each other incredibly effectively, and so we very much want to get them to learn from each other. And then we have a whole platform of learning content that we're developing increasingly at the moment to reinforce the teaching and give them access wherever they are to simple, quick tips and deeper courses on how to make toys out of household objects and how to cook on a budget and so forth. Basically tailoring the intervention to the demographic, to their learning ability, to their budget, that really works in that income resource limited setting. Our model is beyond proof of concept. We've seen over 16,000 children go through the daycares that we partner with. I should emphasize, we do not own daycares. We find existing daycares in the community and we help them. We equip them with the skills they need to run their daycares better. But what they come to us with is an existing client network, which we can't create. And so I think the beauty of our model is not to build something, a castle in the sky, and sort of parachute it onto an unsuspecting community, but rather see what's already there. There's already supply, there's already demand, there's already networks of trust. What's not there is support, investment, network, and technology. And so we layer in those assets that are missing in order to make what is already there better value, more profitable, and more stable for the mothers. And that is shown through the indicators on the children. We do regular development assessments, health assessments on their growth. And we realize that we know what the country indicator of stunting is about 26%. And typically ours are above, better off in the lowest resource settings possible. We have 130 daycares in our network, but that's growing day by day. Actually, I think next week is about 150. And we're also working with a lot of partners in different countries of the region who work in different ways in childcare sectors and would like to learn from us how to actually implement a community-based, market-based model so that they also can get away from a grant dependency type of approach and build entrepreneurship in the childcare space. I've already mentioned we have a lot of technology tools to support the social network. You still need the social network. You still need mothers talking to mothers, our team talking to them. But if we can digitize the reporting in the daycare, if we can track children's attendance payments, if we can give them supportive learning through the phone, and we're in a very tech-driven market, people are using mobile phones at all levels of the economy, then we can really optimally deliver this type of support and lower the transaction costs and make it more democratic, more accessible. We're also experimenting now with the idea of giving loyalty points to parents. So the more they come, they earn points that they can redeem for a free day of daycare, a free meal, to give them more and more incentives to come to this particular network of daycares where they're going to get standardized care, there's supervision, there's access to finance, there's access to learning. And so we're looking at lots of different ways to help mothers in very difficult circumstances have better livelihood benefits than they previously would have. So that's it from me, a little bit of an overview, Lucy. I hope that helps everyone understand the work we do in Kenya and beyond.
Yeah, thank you. That was wonderful. And I think between the video and then what you've just walked through there, there's a really rich picture actually of this space that I'm not sure many people understand in any kind of depth. And you said really right towards the start that there's a lot of attention, and rightly so, on primary and secondary, but less so on this kind of this almost hidden area. I wonder if you can elaborate a little bit more on the nature of the challenge that's sitting there with the systems, with the ecosystem that childcare is part of already.
Yeah, it is a challenging one, but I think it's getting more and more attention in recent years. In a sense, we began this social enterprise, Tiny Totos, before I think that happened. So we were kind of very timely in building this intervention model, this enterprise. But when we started in 2013, I didn't see so much conversation globally, locally around the importance of early childcare. And it's grown enormously ever since. There's a lot of work out there. I think it's the Heckman equation from Harvard. He looks at how early childhood, investments in early childhood will enable a child to basically transcend an economic class. Like if you give them access to early childhood, they will go from a low to a middle income earning bracket because of that type of early stage investment. Something like, for each dollar invested, you get an $80 return down the road. In Kenya, it's of particular interest because the Human Capital Development Index for Kenya is somewhere around 55%, which means very individual. You're only going to get 55% of their true value converted into kind of their lifetime contribution to the economy. And they have 3 key reasons. And I'll get into basically the first one, which is relevant to us, which is stunting below the age of 2. So there's an enormous amount of stunting. I said before, it's something like at least 26% as a national average. But in our neighborhoods, where you've seen studies done where 45% of the children could be suffering from stunting, it's a very, very, very serious problem, especially with the urbanization of Africa. So we've seen the urban advantage has been converted to a disadvantage in terms of child development. There are very few access, ironically, to social services of sanitation, electricity, etc. In these dense communities in Kenya, in Nairobi, 60% of the inhabitants live in slums. So in these informal settlements, you don't have the social services you might have previously expected that you'd get access to. Even with health services, health centers, they're free health services like vaccinations, health monitoring. What we find is that, of course, if mothers are working Monday to Friday, doing everything they can to put food on the table, they simply don't have time to take children for regular checkups. If they don't see anything wrong, they're not taking a day off work to lose a pay that is probably a day wage kind of situation. They're probably not on a monthly contract and getting a bank account paid. They're paid cash in hand. So they will wait till the last minute to take a child to get some of these health services. What Tiny Totos can do by shedding a light on this vast but fragmented informal childcare market is help to coordinate services that families have a right to get, but just simply haven't the time to access, and that government would want to give out, particularly at the health level. There's not, in Kenya and many other countries in the region, a focus on child education below 4, but of course health services are there from birth, and yet there's a lack of coordination. So we work with the Ministry of Health and local health authorities to when we vet children's health. We had some data there about outcomes on growth monitoring. We have very strong ones, but there's also children at risk. So we will refer them to the local health authority before that becomes irreversible, before they're in the stunting stage, so they can get the help they need. Maybe mom wasn't aware, didn't have time. We can do that for her while she's at work. We have for the last few years been working with the Ministry of Health authorities to administer vitamin A and deworming biannually to these children, which is a free resource. Again, they don't always have time to access. We are currently beginning to collect and digitize children's vaccine records because, again, there's lots of gaps. Children are not getting inoculated when the vaccination is free. Our next goal is to, having documented them, provide that information to the health authorities so that they can come and administer those during the working day with the consent of mothers. So there's a lot of work that we can do to coordinate services, but also aggregate these micro businesses and give them access to economies of scale that one by one, with 15 children in a daycare, they can't be able to access or enjoy, and they wouldn't even know how to get. So we have a couple of, actually about 4 tie-ups with companies. I'll focus on the nutritional products. We have 2 products. One is a nutritious porridge, and one is a quick cook lentil porridge dish that we sell through the daycares to the parents. And we can buy it at wholesale, and we can sell it at a much easier, lower price than they would have been able to get in the shops. And actually, they're not really in the shops that they shop at, because they're small little corner shops. Ultimately, being poor is expensive because you spend a premium on every single 100 grams of flour because you couldn't afford to buy the kilo. You were paid $1 that day. You cannot buy a kilo, so you buy a cup. So what we're trying to do is help those that have the least advantages of all in this city be able to get a fair go, have stable childcare. When women have stable childcare, they can focus on their work. They aren't pulled out because the daycare's shutting down, it can't pay rent, or there's a fire, or the child got sick because they weren't well looked after, and then you have medical bills for medicine that you incurred either. We're trying to optimize the service of childcare to start with that, but build many other services on top that I think would be interesting to private sector companies, are interesting to government. Government cannot pay for this service. They don't have the budget, but if it is formalized and brought to a level that meets their policy expectations, they have a lot of reasons to engage and support these childcare entrepreneurs, as do private sector companies trying to access these hard to reach customers. Having our network trust really brings down the transaction costs and really helps them as well. So we see the value of childcare, the kind of way to sustain childcare on an individual level, make sure each daycare runs itself well and can be profitable on its own, but that the network in numbers becomes super interesting to the public and private sector as well.
I want to ask about business model in a minute, but just listening to you speak then, there's so many examples of network and integration and working with what's there and looking at what is, and rather than trying to put something over the top of it or introduce a new system, every example you're talking through is about this is this situation and we're connecting a node or we're making something easier. And it sounds very complex. I'm interested. It also sounds very people heavy. So I'm quite interested in just strategies that you have for when you have scale in mind, but you're working with complexity and you're working with people and relationships. What are some of the strategies that you're using?
Yeah, and it's a really good point, and it's actually one that we're incredibly highly focused on right now, because you're right, it is very complicated at one level. I'd say that there's the systems of scale and support around the digital tracking tools that we've built that help us see what's going on in the daycares, help them record attendance and payments. There's the sort of social franchise content library, this e-learning platform we are still building. We have not finished it, but we realize all the kind of information for parents, for managers of network should be sitting somewhere where anyone can access it. Those are in some ways almost easier than the part that you mentioned, which is the operations piece. And we have given that our massive priority right now, because there's a need to really balance what is just enough of an intervention that you don't distort the market, you don't create dependency. And in my humble opinion, and I may be wrong, but this is just my lens on the space, there's been a lot of dependency creation or sense that the only way out of this is charity, and therefore we just need to give kind of alms to the poor. We really need to just subsidize this whole thing. We have realized that that's not necessarily the case, but we are still in the process of working up that right balance with a goal to, in a sense, and I use business terms maybe a lot, which is uncommon perhaps for this space, but unit economics needs to go down. We can't be spending the same, clearly not more, for every new daycare that we're bringing on. So what we do, last week we had a boot camp where we brought on a bunch of new daycares. We get some of the existing managers to facilitate training, to tell them about their journey. Our idea is that, well, we have a kind of transition period, a transition process for managers, and if they become what we call a peer star, they can do on training to other new daycares, because it's very authentic.
Yeah.
For them to say, this is how I walked this journey. I mean, if we built a beautiful big daycare or a center and brought them there and said, look at what we've built, and they're on a bicycle and we're showing them a Mercedes-Benz, it's hard for them to feel encouraged that they can get there. But if they're on a bicycle and someone else has a motorbike, or a Toyota Vitz. It's much more achievable. So for us, it's trying to work out how we provide the support, the knowledge tools that will enable a community health worker, another manager to on-train more managers in the network to keep that kind of personal touch that I think is very important in building the trust, the knowledge. You can't just rely on tech alone. We call ourselves tech enabled, but we are not a tech alone company. But for us to sort out what are the key resources they need and to provide just enough support and not too much that they still really believe in their own entrepreneurial journey. And I must say, when we meet a lot of the daycares, they're just hand to mouth themselves. They're just hand to mouth, okay, today, tomorrow. And so we step back and say, you've maybe never thought of yourself like this, but you're running a business. We dignify you not as a beneficiary, but as a businesswoman. This is a business. Now, what do you need to think? What do you need to plan ahead? Okay, there's school holidays coming up. You know your income's going to go down because the older children will look after the younger children. Mom will save money. She doesn't pay for daycare per month. She pays every day she's working. So she has an alternative. She may just use that. So how do you plan ahead for savings for the low period? How do you diversify by selling packaged nutritious food on top of childcare, on top of cooked meals? What else can we help you think through so that you have a long-term vision? And one of the, the most exciting outcomes of this work is when one of the daycare owners says, I'm going to open a branch somewhere else. I'm going to have 2. I can see how I can run 2. I might have 3, and that to me is mindset growth. So we're really looking at behavior change, aspirational change, and it does take time. And we still need to really work on exactly the right balance and invest in all the support systems that enable us to do this at scale. So we are in an active fundraising mode for that. But I think that it is, there's a lot of promise along the way.
Yeah. So let's bring things to a close. Well, as a few final points. Tell us a little bit about how that business model works currently, what you're moving to, and then what you're looking for next to go to the next level.
Yeah, for us, up to now, we're a social enterprise, a company limited by guarantee. We are able to earn money as long as it's reinvested in the work that we do. We've earned probably 10% to 90% of our funding is grant, 90% is grant, 10% is earned revenue from micro lending, from sales, but increasingly from advisory support to those partners that I've mentioned that are looking to us for help in expanding. As we build the e-learning platform, as we get more to an open market stage, we're looking at subscription income from parents who just want to get on and have some resources, very micro payments for learning. We're looking at working, as we are in Rwanda, with private sector companies who want advisory services set up childcare centers for employees in their own company areas, because having focused workers really helps their bottom line. So it pays off to invest in childcare. So there's a number of partnerships, and I've already mentioned partnerships with companies who are like, oh, you have a really good network of people that I can't find. They're not banked. They don't use mobile money. I'd like to sell them porridge, or I'd like to sell some sort of baby product. How do I access them? And we can have a partnership on those levels. We do need to get to scale for that. So we are still raising funding to be able to do that. But I think the bottom line is all of our daycares in our network meet their own costs themselves. We invest in the training and infrastructure, but they pay for their day-to-day costs. And so they're profitable. The majority of them, almost all of them, are profitable. TTK, Tiny Totos, as a social enterprise, we'd like to become more independent of grant. We're not looking at a kind of profit future, but to us, being able to cover our costs and then some and grow would be hugely powerful story in a sector that is so used to recurrent grant costs to do anything over and over again. We found a way, I think, that we can work with the market, what is already there, to build value where maybe people haven't seen value before, to build sustainability where no one ever saw sustainability could exist. It'll take us some time. We need to get to a much bigger scale, but we're very excited about it and happy to work with more partners on that journey.
Yeah, wonderful. I guess a final question. What's going to make the biggest difference to getting to scale, to your success in the next kind of 2 to 5 years? Is it something changing in the social system? Is it simply funding? What's the combination of factors that you're looking to really bring together?
I think, we've been kind of building the plane while we're flying it. We've been doing this work and then going, actually, it'd be much easier if we had a phone-based reporting system. This paper problem, getting paper reporting is like really a hindrance to scale, or we need standardized teaching. Like we can't use the same person to do the nutrition training over and over again. That's an impediment to scale. So we've got to like codify, digitize learning. And then our operating systems, are they as lean and efficient as they could be? Not sure. So our goal is over this year and next to have those done. And to be honest, after that, I don't see too many limits to growth because the demand is so enormous. I'm sure we may need a few more kind of people on board, but ultimately our goal is to be as lean and open and partnership driven as possible, because the challenge we're facing is very widespread throughout the region and even beyond. And I think the model we've built has the ability to be really impactful in many more places, working with many more partners than we do today. So I can see it. It's really finishing the airplane, building the airplane, and then going as far as we can go.
Yeah. Wonderful. Listen, it's been incredibly enlightening for me personally to learn more about this part of the sector in the region, and to hear more details about how all of those systems fit together. I know lots of other people will be interested, so people will be able to get hold of Emma either through the virtual platform of the summits and all the other places that you can usually find people. And yeah, really look forward to seeing how this develops in the future. It's such an interesting one. Thank you so much for taking the time to talk us through it.
Thank you, Lucy. Thanks for the opportunity. And yes, anyone who wants more information, please do feel free to reach out.